So the topic that I'm gonna talking about is exploring the association between physical activity and healing outcome among individuals with venous leg ulcers. So I want to start with acknowledgement of the country and pay my respect to the elderly, both past, present, and emerging, acknowledging them as a traditional custodian of the knowledge for this land. So in this presentation, I'll covering the following aspects: the definition of some key terms that will be used throughout the presentation, and what is already known in these areas, the research aim, and the overview of the research methodology that we used, and some key findings. So I want to start with some definition of the key terms. So first is, what is venous leg ulcer? So venous leg ulcer is typically developed as a result of the malfunction of the venous valve that results in the hypertension in the leg vein and damage to the small blood vessel that is resulting in a skin ulcer. And it is very common for it to be formed between the knee and ankle in the median gaiter of the lower leg. As you can see on the left side of the picture, this is what it will look like when we have intact valve. So the reflux of the blood is actually prevented during the calf muscle when it's relaxed. And on the right-hand side is what it looks like when the people have a damaged valve. So the blood will be pooling out. So the valve will not be able to hold the blood will be pulling out in the calf muscle. So the second key term is physical activity and exercise. So when we say physical activity, it's any type of body movement. It's like what we're doing now. We're sitting here is kind of physical activity. Walking is physical activity. Doing housework is physical activity. But exercise is classified as a type of physical activity that is more structured, it's plain, and have repetitive patterns, which with a specific goal to enhance or maintain our physical well-being. And the third one, the last one of the key term, is compression therapy. So when we say compression therapy, it means that it's used controlled pressure by wearing compression bandage or graded compression stocking up to the knee high to increase the blood flow in the lower limb and improve venous blood returning back to the heart. So what we already know in this area, we already know that venous leg ulcer is the most common type of leg ulcer that is increasingly seen in the primary healthcare settings, which is account for over 60% of all chronic neck ulcers. And chronic neck ulcers are not only cause, the physical and psychological distress, but it also place a considerable financial strain on the patient and healthcare system. Let's take Australia as example. So each year, Australia's system will spend roughly around $3 billion annually. That is only cover the costs that occurred at hospital and residential care settings. And as we mentioned that venous leg ulcer is commonly happening in the elderly. So there's out-of-pocket for the elderly, and it's averaging roughly around $27.5 million annually for the patient themselves. And that is to cover fees such as private clinical consultation fee, the travel and parking, and the cost to buying the consumable for the wound care products. And the chronic infective venous leg ulcer can be 4 times higher for the cost of it to managing compared with active and healing venous leg ulcers. And the mainstay of treatment venous leg ulcer currently is compression therapy. However, even with appropriate compression therapy treatment, the healing period for venous leg ulcer still varies from several months to several years, and up to 70% of the patient will be experiencing a recurrence within 3 months of the wound closure. So physical activity and exercise may improve the venous leg ulcer healing outcome when it's used in combined with compression therapy. And the reason is that whenever this picture, what it would look like. So whenever we do physical activity, the calf muscle actually acts as a pump to get the blood, to help the blood that was pooling on the lower leg to return back to the heart. That is the main, the aim why we think physical activity will help with healing of venous leg ulcer, and we wanted to basically increase the strength of our calf muscles. However, what we don't know currently is that what is the nature of physical activity in people with venous leg ulcer and how it changes over time, and how and whether these differences in physical activity levels actually affect the healing and the recurrence. So the aim of this research is to explore the effect of different physical activity levels healing on healing and recurrence in people with venous leg ulcer, and the following number of questions will be explored. So which will be exploring, is there any difference in the healings and recurrence outcome of target ulcer between people with different level of physical activity? Or what are the association between physical activity level, pain level, and quality of life among people with different activity level? And is there a change in physical activity during venous ulcerations? So the design of this study this is a secondary analysis of data from a prospective observational multi-cohort study, and we're using the data that was related to aspirin in venous leg ulcer randomized control trials. And this data was collected from 5 outpatient chronic wound clinics that is in Queensland, New Zealand, Victoria, Tasmania. That was between 2017 and 2018. And in this study, we include participants that was 18 years old and over and have experienced at least one active venous leg ulcer for at least 6 weeks or had a prior history of venous leg ulcer, and will exclude the patient who were unable to speak English or who was unable to provide consent. So the data resources, we're using the questionnaires and medical record to collect the data from participants at 3 time points, which is a baseline, week 12 and week 24. And here are the following outcomes that we used to measure. So we measured physical activity level that was reported by a participant. We used rapid assessment of physical activity instruments that instrument was created with the purpose of evaluating the routine physical activity engagement of the elderly, that including parts such as its types, quantity, and intensity. We also measure the ulcer healing outcome. This is one of the primary outcomes. We include the proportion of the ulcer that was healed, time to healing, and if there's any changes in the target wound size and the recurrence of the target ulcers. We also measure the health-related quality of life using ED, EQ5D5L instruments. And we also measure the wound pain score that we're using numerical rating scale from 0 to 10. So here are some main findings of our research. So in this study, we include a total of 2010 participants, and the average age of all participants was 74 years old, with the average target ulcer duration was 5 months. And we find that the higher physical activity level was actually associated with shorter time to healing. And the moderate to vigorous group actually took fewer number of days to heal than the people who are in sedentary groups. And he is what it looks like, as you can see in the figures. So the people who was in persistent moderate to vigorous physical activity group, as you can see, the number of percentage of not healed was actually decreased dramatically at around day 45, which is right here. However, comparing with people who are in the persistent sedentary group, as you can tell, the percentage of not healed was actually remained quite high throughout the study period. And we also find that the high level of physical activity were associated with better quality of life score at baseline and week 12 and week 24. And we've evaluated all the physical activity level for all the participants during the study period. And we find that most participants, around 48.5%, were reported to have a lower level of physical activity, and they remain lower during the entire study period. So that's just what it looked like. So for people, as you can see, a large percentage of people was actually falling to the light physical activity group, and they will remain as the highest percentage throughout the whole study period at both baseline, week 12 and week 24. And yep, so what are the implications for future research and clinical practice? So based on the results, we can see there's definitely a need to promote a physical activity in these patient populations. And because this is secondary analysis, so we recommend any future clinical trial to actually explore the interaction between the physical activity characteristic that is including the intensity, duration, and dosage to see if there's any of these differences in this characteristic can affect the ulcer healing outcomes. And also future research should also investigate the preference of the leg ulcer patient for exercise intervention programs. So here are some reference, and thank you for listening.
That's fantastic. Thank you, Shirley. That's I was thinking as you were presenting, it's amazing how, you know, all these little things that we think are so simple are not so simple at all. And we all, you know, we know people who've experienced this. So that's great. Thank you. I don't